For the ACA portion, I want us to talk about calculating the household size and income for ACA. So when you go into Health Sherpa, you will see, to do a quote, you're going to see something that, looks like this, and you'll be asked to put in the household members and the household income. Those two things will determine the eligibility for premium tax credit and for cost share reductions. So we want to talk in depth about those two items today. So let's talk first about who you need to include in the household. So just keep in mind that when it asks for household, it's asking about tax household. Okay. Now, a family may have, a relative living with them that has a separate job and files separate taxes. And so you would not need to include them. If they're filing their own separate taxes, then they don't need to go into when you figure this household. It's going to be the tax filer, the spouse, and the tax dependents. Just think of it like whoever is on that tax return for the year they have coverage, that's who you need to include in the household. Okay. And so here's just some basic rules. You're going to include your spouse if you're legally married. We are going to talk about 3 exceptions to that in a few minutes. Also, if you plan to claim someone as a tax dependent for the year you have coverage, they need to be included on that household and on that application. If you're not going to claim them, sometimes you might run into a situation where, a mom and a dad have a child that's 20, 22. If they're already, even if they're living in the house with the mom and dad, if they have their own separate job and they're going to file their own tax return and they're not going to be claimed as a dependent, then you don't count them. Okay. And you put those people on the application, even if they don't need the health coverage, there will be a place to indicate that they're not applying for coverage, but they still need to be included on that application as part of the tax household. And so those are just some little basic things to remember. And if you want to get a little more in detail, when I send these slides out, this is a link that will take you to a document that will explain in greater detail, because I know sometimes you run into unusual situations and you need to know who to count. And so that would be a helpful resource there. So I mentioned that there were 3 exceptions to a person that is married. Normally, the general rule is if you're married, then you have to file a joint tax return. But there are some exceptions to that. Okay. So that's to be eligible for a premium tax credit. Normally, you would have to file jointly with your spouse. But if one of the spouses is a victim of domestic abuse, then they can put unmarried on the application. Okay. Also, if the person is an abandoned spouse, they can also put that they're unmarried. And I just copied this information from healthcare.gov. This is the definition of it, okay, of the abandonment. When an individual can't locate their spouse after making a reasonable attempt to find them, okay, they can select unmarried on the marketplace application. And, that might make someone feel a little uncomfortable if they are married and you say, well, it's okay, we can mark unmarried. And so if someone's feeling uncomfortable about that, because you do have to attest that everything you're putting on the application is true, you can find, this is on healthcare.gov, and you can find that you're not going to be penalized in any way. Here it says you can say you're unmarried on your marketplace application without fear or penalty for misstating your marital status. And then that way, the person that's married can still get the premium tax credits or cost share reductions that they wouldn't otherwise be eligible to get if they were not filing jointly with their spouse. So those are 2 of the exceptions to that general rule, okay? The other one is the head of household. And so when a person is married, if they can meet these qualifications, if they can answer yes to all of these questions, then they can file as head of household. And they do not have to file jointly. Okay. So will you file taxes separately from your spouse? Will you live apart from your spouse from July 1 to December 31st? Will you pay more than half the cost of keeping up your home? Is yours the main home of a child, stepchild, or foster child for more than half the year? And are you eligible to claim the child as a dependent? And if you can answer yes to all of those, then you can file as head of household. Now, I do want to note that the Health Sherpa application is not set up to accommodate this. So if you have a person that can answer yes to these questions and they want to file as head of household when they file their taxes, then when you're helping them enroll, you will either need to call into the marketplace or complete the application on healthcare.gov. Okay. And if anybody has any questions, feel free to just unmute yourself and jump in. I know sometimes it's a lot to take in. If so, feel free to jump in and if I need to clarify something. So just as a rule, if someone's married, they're always going to need to include their spouse unless it's one of these three situations. Okay. If they say, well, I had this situation, I don't know why, but the married couple said, well, we don't file jointly. We still file separately. They live together. They're a normal couple, but they just want to file separately. Well, then they will not qualify for the premium tax credit or cost share reductions. They can still enroll. The plan will just be at full price. Okay. So that doesn't prevent them from being eligible to enroll. They just will not be able to receive the premium tax credits unless it's one of these three exceptions. Okay, and then for determining dependents, this is a link to a document that will help you determine who can be claimed as a dependent. Most of the time, people know who they're claiming as a dependent for that year. It's, most likely going to be their child, and it's pretty cut and dried. But other individuals can qualify as dependents. Perhaps they might have like a parent that lives with them and they provide for that parent. And so this is just a little check sheet that you could go through that will help you determine if a person can be a dependent or not. Okay. So if you run into that situation and someone's not sure if they can claim someone as a dependent, just go to this document. You can bookmark this and you can just go through this list of questions to see if someone qualifies as a dependent. Okay, so now let's talk about what counts as income. So when you fill out the marketplace application, you're going to need to estimate the household income for the year that they have the coverage. Okay. Sometimes people want to look back and say, well, last year I made this, and that's fine if everything's going to stay the same. But many times people have changed jobs or maybe they've retired. And so their income will be different for the year that they're going to have marketplace insurance. And so you want to estimate the income for the year they have the coverage. Okay. What do they expect they're going to make? Now, the premium tax credits and cost share reductions, they're determined by that MAGI. And that's just the modified adjusted gross income for that year. And that doesn't, specifically appear on the tax return. But for most people, it's going to be line 11 on that 1040. If if nothing's changing from the previous year, then they could just look at that and get a pretty good estimate. Of course, if something has changed about their job or their income, then you'll need to just help them estimate what their income will be for this year. And this is a link to a income calculation worksheet. If you want to have that printed out and fill it out with the person, that's something you can do, or you could give it to them and let them fill it out and get back to you. So So, Alicia was nice enough to share this with me. It's something that she had found, and I thought it was really good, so I wanted to share it with everybody else. It just talks a little bit about how you can find that magi. If so, like I said, most of the time it's going to be this line 11 on the 1040. But if well, you can read this. If you have a different dollar amount for line 6A versus 6B, this is the calculation you would use. Okay, you would take line 11 and you would subtract line 6B and then add line 6A. And that gets your magi. So you don't have to memorize this, but you may want to take a screenshot of it and just save it somewhere and have it handy in case you need to figure that out. As a general rule of thumb, if someone's got a complicated tax situation, like for example, I help some people and maybe they have like some foreign income and things that I'm not sure how to count, I just always refer them to their accountant and let them get a number from their accountant. That makes me feel more comfortable. And I don't have that sole pressure on me of determining how we need to count everything. So I would say never hesitate to refer someone to their accountant, especially if they have a complicated tax situation. But just for general purposes, you want to know what types of income you can count in your estimate. And so here's just a quick list. There's also a chart in the ACA handbook that goes into more detail, and I've linked it in these slides also. But obviously, like if you have a job, that income's going to count. If you have investment income, if you draw Social Security, that's going to count. If you're self-employed, if you draw a retirement, if you're on Social Security disability, that's going to count. Tips or unemployment compensation, all of those are going to count. Some things that wouldn't count, child support, gifts. Here, this one always kind of confuses me a little bit, the SSI versus the SSDI. So we're going to look at that a little bit more in detail, but here's that income definitions link. If you have something that you want to investigate more and it's not on these slides, then you can click on that link and find more detailed information about what to count as income. But just quickly comparing the SSI and the SSDI, those sound a lot alike and you might get them a little confused. But the SSDI is the disability that someone that's had a work history and then, they become disabled and they're drawing that and they're eligible for Medicare after 2 years on the disability, then that does count as income. Okay. But SSI, say, if you've got the mom and she's got maybe a disabled child that's drawing SSI, it could even be an adult dependent. If they draw SSI, that does not count toward the income. Okay. So just don't get those confused. Keep that in mind. Okay, so we've all seen this chart and we know how important it is. If you don't have it saved, here's a link to it. And I know it says 2024, but for marketplace purposes, plan year 2025 plans, they're based off of the 2024 federal poverty guidelines. So I know the 2025 guidelines are out, but those will pertain or be applicable to plan year 2026. Okay. So for plan year 2025, we're still working off of these 2024 poverty guidelines. And the reason I put this on here is because, this just explains a little bit about how much, depending on their income, how much they're going to, expect to pay toward that premium. So I just wanted you to be aware of that. All right. So if a person gets a marketplace premium tax credit to lower their monthly payment, then they do have to reconcile that when they file their taxes. Okay. That means that when they file their taxes, the amount of premium tax credit that they used during the year that was used to lower their monthly payment will be reconciled compared with what their actual income is for that year. We estimated what it would be, but if it's different, then they're going to have to either pay back the part that they weren't really eligible to receive, or if they are eligible for extra that they didn't use, they can get that back. Now, some of those things may change depending on, legislation, but as of today, that's what's still in effect. Now, there are some repayment limits right now. These things are all subject to change, but for today, there are some repayment limits. So if someone estimates their income incorrectly and they receive more tax credit than they should have, if they're under that 200% of the federal poverty limit, a single taxpayer would only have to pay back $375. Okay. So that, just keep that in mind, that there are some limits on that. However, you always want to encourage people to estimate, to get the best estimate as possible and keep that updated, just to avoid any kind of repayment. Now, so I've mentioned a lot about the premium tax credits, and we all know that those go directly toward the premium to reduce the monthly premium. But there are also cost share reductions. And depending on the income, you will see that someone may qualify for cost share reductions. In Health Sherpa, over to the right-hand side, when you do a quote, under the amount that they're going to be eligible for monthly for their premium tax credit, under that, you'll see it looks kind of like a little gold octagon maybe, or badge or something. And that's showing you that they qualify for cost share reductions. And so individuals and families with incomes up to 250% of the federal poverty line are eligible for the cost share reductions. But remember that those cost share reductions only apply to the silver plans. Okay. So if you see that someone's eligible for that, scroll on down to those silver plans. They may be a little bit more expensive, but the deductible will be less. The out-of-pocket expenses, like the co-pays and the max out-of-pocket, those will be less because of the cost share reductions. And so, just as a general rule of thumb, if someone qualifies for those cost share reductions, those silver plans are most likely going to be their best option. So just keep that in mind, that those cost share reductions apply to the silver plans only. And when taxes are reconciled, they don't have to pay anything back toward those. Okay. If they've estimated their income incorrectly and they have to pay back part of the premium tax credit, they don't have to pay anything back for the cost share reductions, even though they may have received them in error. Okay, so now let's talk just a little bit about Medicaid expansion. Some states have expanded Medicaid, but Alabama has not. So unfortunately, what that means is there is a gap. And I'm sure if you've done ACA for very long, you've already run into this problem. Okay. You're going to have people that their income's too high for Medicaid, but they're not quite to that lowest level on the poverty chart in order to get the premium tax credits. And so they're falling into that gap. And that is an unfortunate situation. I always hate it when I run into that with someone, because, you always want to be able to help. So here's some options. All right. You can fill out the application, and then there'll be a little box here at the end where you can check it, and you can send that application through to Medicaid. And maybe something has changed and it would go through this time and they could get Medicaid. That would just be one thing that you could try doing to help them. And then another thing that I want to talk about is that you can explain the whole situation to them. I've done this several times. I've had an elderly lady, her income was made up in a large part from what she was drawing off of some investments that she had. And she had lost her premium tax credit last year, when she got her notice about what her premium was going to be for 2025. And so when she called me, I said, well, what you would need to do is could you draw out a little bit more of that interest, because you need to get your income up to, let's just try to get it up. If you could get it up to like 16,000, because that lowest level for her would be like $15,060. I said, if you could draw out a little more. And she was like, oh yeah, that's not a big deal at all. I'll just draw out a little bit more of that interest and count it as income, if that will enable me to keep those premium tax credits. And so that was what she was able to do. You may have a situation where when you explain that to someone, that if they can make a little extra money and get to this level, then they would qualify for the tax credits. They may be able to do a little extra job. They might be able to cut grass or take on a few extra hours or babysit or do something, even
Watching
if
Heather
it's,
Fowler do an ACA.
hey, hey, um, so
Okay.
anyway, I may need to mute that. Oh, but it's okay. Okay. So anyway, just explain that situation the best you can to someone. And if they feel like that they can honestly try to make that extra amount of money, then, you can put that on the application. And if they don't, for some reason, end up making that amount, there is a safe harbor. Okay. And I've copied this and pasted it just so, because that is something that you might worry about. Well, what if they don't? What if they say they're going to make that 16,000 and then something happens and they don't? Well, there is a safe harbor and they're protected and they're not going to have to, pay back that tax credit that they received. But you do want them to understand that they need to make an effort to make that amount of money so that they do legitimately qualify. And, depending on what legislation is passed, these types of things may start having to be verified. And so this is just, as of today, this is how it is.
Yeah, but you got an M&M.
Did anybody have a question? Okay. All right.
Hey, Heather, I'm sorry.
Hey,
This is Rick. I'm sorry. Can you go back to
no,
that?
no.
I had a client come in and I missed half, but can you go the past slide that you just had? I'm sorry.
Yes. Yeah. Well, that's good, because this is something that, there I get a lot of questions about, and I had a lot of questions about it also.
So
And so,
my question is this is, I work with a lot of individuals that are low income,
right.
and some of them, like you said, their income's too high for Medicaid, and it's too low for the marketplace. Okay. And so, I've done the instruction of the $16,000. What does the term safe harbor mean? I'm trying to understand the concept because, I've been told that if you don't make that amount of money, you could pay the tax credit back. If you make over that amount of money, you're going to pay the tax credit back. It seems like there's no median, there's no happy middle point.
Okay. So what I have found through researching is that if someone projects, okay, just let's take an individual and they project they're going to make 16,000, and they're just a household of one, and then they only end up making 14,000, they are protected. They're not going to have to pay back that premium tax credit. They're not going to have a penalty for
Okay.
that as of today. Now, I don't know how things might change going forward. And I have heard a lot about that people are going to be asked to verify their income. So, that's going to probably not some people out of getting this premium tax credit if we have to start submitting more documents verifying that they have a reason to expect that they would make that money. So I don't know how all of that's going to play out. I think it's just actually being probably still debated as we speak, what's going to go through and what's not. So it will just have to stay on top of that situation. But as of today, if someone estimates it high, estimates above that, and then they don't reach up to that 100%, they do not have a penalty.
Okay.
They don't have to pay that back.
So they're looking at, so they're looking at the FPL when it comes to filing their taxes then, correct?
Yes,
Okay.
yes. And so this was just the exact, that was why I copied and pasted this, because I thought I want to, get this statement exactly right. But if someone projects their income above 100% of that federal poverty level, and they receive the premium tax credit, but at the end of the year has an income that falls below that 100%, they are protected by a safe harbor, and they are still considered eligible to receive the premium tax credit. And so they don't have to pay it back.
Okay, thank you. Appreciate that.
Yeah, no, I'm glad you asked that, because that's something that would always make me nervous. And I would never want somebody, especially if they're already struggling financially, to have to pay back a penalty like that. So,
Okay.
okay. And so just very important, make sure people know that they need to report their changes to you or to the marketplace. I always encourage people to just call me if they have something change about their income, and you can just go in and click on view or edit their application, go to income, and then, update that. You will need to go ahead and click all the way through the application, because their premium tax credit will probably change, their premium will probably change, and they'll need to re-enroll. I thought I had a little slide. Yeah, well, I guess I didn't. But yeah, you'll see this. It'll say you're not done yet. You need to confirm your plan, and then you'll need to click enroll in this plan. Okay. If you don't click that enroll in this plan, then it's just like they're still in there shopping for a plan, and everything's going to stay the same with their premium tax credit in their premium. And so even though you've updated the application, until you verify their new plan and enroll them in that, then it's not actually updated. Do you see what I'm saying? Like, if they've been paying zero and then you update their income and they're needing to pay $35 until you hit enroll in that plan, that's not going to update. So just be sure that you do follow all the way through with that application, and that you send them an enrollment review and they approve that new plan, and then you hit enroll. Okay. And they will need to, if their premiums increase, then they can call Blue Cross and update their payment information so that that new premium can be taken out. Now, this was something that I had never really thought about, and it's a little bit hard to wrap your head around, but again, I just copied this and pasted it so that I wouldn't get anything wrong about it. But when someone calls you and reports an increase in their income, then the premium tax credit is calculated based on the new income. And notice this, without regard to what they've already received that year. Okay. So I'm just going to read through this example. You read through it and think through it with me. Okay. So at the start of the year, Kim's tax credit is $2,400 for the whole year. Okay. Like January 1, she was going to get $200 a month based on the income that you put in. Right. Well, in September, Kim calls you. She says, hey, I've gotten a raise. And when you put that in and you calculate her new tax credit, it's going to change. Okay. So now keep in mind, she's already, because she's had it from January to September, she's already used $1,800 of that premium tax credit. Okay. She was going to get $2,400. She's used 1,800. Now she's updated her income. And what it's showing you is that she's going to be eligible for $1,200, but that's for the whole year. Okay. And remember, this is already September. So everybody still, I know this is kind of confusing, but if you think about that, that would only be that she only should get $100 a month based on that new income. So she's already used up. See, she's already used 1,800, and based on her new income, she's only really eligible to get 1,200 for the year. And so you're going to, since she's already gotten more tax credit than she's really going to be eligible for, you don't want to go ahead and use any more. You want to reduce, there's the little box on the application there where you can check that she doesn't want to use all of her premium tax credit, or she doesn't want to use it. And so you're going to need to reduce that to 0, because she would have already used more than she's going to really be eligible for. Okay. And otherwise, she's going to have to repay the excess that she gets. Does that make sense? Okay. It's a little bit, just think about that. If you go in and update somebody's income, just remember that that's a thing. All right. And so we've already talked about this. And if you are asked to verify income, this is a link to the documents that you can upload to do that. All right. And so if you want to just learn more about,
that's top of mind.
and so Philip, did you have a question? Okay. All right. And so if you do want to learn more about this, this is a link to a longer webinar. I watched it a couple of times and it's great. So, that's a link to it, and I would suggest watching that or listening to it. All right. So, that's all I've got. Does anybody have any questions? Well, if not, I appreciate you, watching today. And if you're watching the recording, I appreciate you watching. And if you run into any problems or any questions, just, feel free to reach out to me. You can call me or email me, and I will be glad to help you. And so, thanks for watching, and I hope everybody has a good day.